I'm Paige, and today we will be talking about de-escalation techniques and mental health. De-escalation techniques and ways to avoid escalation in mental health patients applies to all healthcare professionals, the patient, the support system, and any law enforcement that might be involved in the situation. Before even entering the room, it's essential that healthcare individuals are trained in signs and symptoms of escalation and know de-escalation techniques. According to Stubbs and Dickens in 2008, this includes observing for signs and symptoms of agitation, approaching the patient calmly, removing any triggers, and using verbal techniques to communicate. According to Dzubak in 2017, get to know yourself and how to handle the situation in an appropriate and professional manner. First, upon entering the room, the nurse should use verbal contact by introducing herself with her name and her title. Also, orientate the patient to where they are and ask what he or she prefers to be called, all in a polite manner while displaying appropriate body language. This includes keeping your hands visible, staying calm, and having appropriate facial expressions. By keeping interaction to a minimum of how many people that they interact with during their hospitalization might help keep the patient calm. Ensure safety in the room is important for the patient, the staff, and yourself. Ensure there are no weapons or potentially dangerous items in the room, and protect yourself by keeping personal space between you and the patient. According to Berlin, FIshkind, Holloman, Zeller, and Wilson in 2012, this includes 2 arm lengths away. It's also important to have a way out of the room. Never let it be so that you could be cornered. Also, let the patient know that they are safe. If needed, a support system could stay with the patient, but if there's tension or they aren't on good terms, it's better to avoid it as it might be a trigger. When engaging in conversation with the patient, be concise and simple. Give them plenty of time to respond and repeat the question if needed. Active listening is important in the relationship, and you may also find information about the patient, like what their wants and their needs. Set limits with the patient and inform them of what's acceptable behavior. Be empathetic towards the patient, but in a professional manner. Do not humiliate them, as it could be a trigger. And as we all know, restraints are always a last resort. According to Stubbs in 2008, avoid the use of IM medications if applicable. First, try oral medications, and if that doesn't work, then you can use the IM route. After an escalated situation, debrief with the patient once they're calm, and then debrief with your team to talk about ways that you could improve with the next situation. The rationale of these proposed strategies are effective quality patient care and positive patient outcomes. According to Power in 2010, on page 115, it states, "We must help them create a bridge from mental illnesses to a life in the community." The implementation timeline is immediately once the patient is in your care. Start with techniques to avoid escalation situations. Then, if escalation occurs, use the de-escalation techniques. If de-escalation is effective, it will give the healthcare team an opportunity to give appropriate care to mental health patients. If escalation occurs and the healthcare team fails, it's a learning experience to better our team and ourselves. To evaluate this plan, we look at the patient outcomes. We can evaluate the patient's recovery according to Zeller, Bricker, Schuster, Pancoe, and Resta in 2011 with their self-esteem, empowerment, and social support. Also by ensuring that they have appropriate resources, education, support, and control. As healthcare professionals, it's our job to know these techniques and strategies to ensure that the patient has a positive outcome. Thank you.